What starts here changes the world. I have a few suggestions that may help you on your way to a better world. And while these lessons were learned during my time in the military, I can assure you that it matters not whether you ever served a day in uniform. It matters not your gender, your ethnic or religious background, your orientation, or your social status. Our struggles in this world are similar, and the lessons to overcome those struggles and to move forward, changing ourselves and changing the world around us, will apply equally to all. So here are the 10 lessons I learned from basic SEAL training that hopefully will be of value to you as you move forward in life. Every morning in SEAL training, my instructors, who at the time were all Vietnam veterans, would show up in my barracks room, and the first thing they'd do was inspect my bed. If you did it right, the corners would be square, the covers would be pulled tight, the pillow centered just under the headboard, and the extra blanket folded neatly at the foot of the rack. It was a simple task, mundane at best, but every morning we were required to make our bed to perfection. It seemed a little ridiculous at the time, particularly in light of the fact that we were aspiring to be real warriors, tough, battle-hardened SEALs. But the wisdom of this simple act has been proven to me many times over. If you make your bed every morning, you will have accomplished the first task of the day. It will give you a small sense of pride, and it will encourage you to do another task, and another, and another. And by the end of the day, that one task completed will have turned into many tasks completed. Making your bed will also reinforce the fact that the little things in life matter. If you can't do the little things right, you'll never be able to do the big things right. And if by chance you have a miserable day, you will come home to a bed that is made, that you made. And a made bed gives you encouragement that tomorrow will be better. So if you want to change the world, start off by making your bed. During SEAL training, the students are all broken down into boat crews. Each crew is 7 students, 3 on each side of a small rubber boat, and 1 coxswain to help guide the dinghy. Every day your boat crew forms up on the beach and is instructed to get through the surf zone and paddle several miles down the coast. In the winter, the surf off San Diego can get to be 8 to 10 feet high, and it is exceedingly difficult to paddle through the plunging surf unless everyone digs in. Every paddle must be synchronized to the stroke count of the coxswain. Everyone must exert equal effort, or the boat will turn against the wave and be unceremoniously dumped back on the beach. For the boat to make it to its destination, everyone must paddle. You can't change the world alone. You will need some help. And to truly get from your starting point to your destination takes friends, colleagues, the goodwill of strangers, and a strong coxswain to guide you. If you want to change the world, find someone to help you paddle. Over a few weeks of difficult training, my SEAL class, which started with 150 men, was down to just 42. There were now 6 boat crews of 7 men each. I was in the boat with the tall guys, but the best boat crew we had was made up of the little guys, the Munchkin crew, we called them. No one was over 5'5". The Munchkin boat crew had 1 American Indian, 1 African American, 1 Polish American, 1 Greek American, 1 Italian American, and 2 tough kids from the Midwest. They out-paddled, outran, and outswam all the other boat crews. The big men in the other boat crews would always make good-natured fun of the tiny little flippers the Munchkins put on their tiny little feet prior to every swim. But somehow these little guys from every corner of the nation and the world always had the last laugh, swimming faster than everyone and reaching the shore long before the rest of us. SEAL training was a great equalizer. Nothing mattered but your will to succeed, not your color, not your ethnic background, not your education, not your social status. If you want to change the world, measure a person by the size of their heart, not by the size of their flippers.
Hello, everybody, and welcome to the CARES Project podcast. Today we're with Ronald Owens, who served as an information officer at the California Department of Public Health during the COVID pandemic, or at least till the start, around the start of the COVID pandemic, and you were a whistleblower about what you saw there, and you're here with us today to tell us a little bit about your story. So, welcome to the show, and introduce yourself to our audience, please.
Well, thank you, Dale, for allowing me to share my whistleblower story with you and your audience. You're correct. I was with State Service here in California. I was classified as an Information Officer 2. And essentially, that's a person who is a mid-level manager in the Information Officer series here in California. They're the liaison between program staff and the media. So in essence, say, for example, you wanted to ask a question about food recall. You would call the Office of Communications, that's what it's called now, and you would ask about the food recall because of some sort of contaminant or compromised food, and I would get responses as a public information officer for you and your audience. So essentially, an information officer is a liaison between the media and the program staff. And I was hired at CDPH of the California Department of Public Health in early 2009, and I started at CDPH on March 2nd, 2009 to be exact.
Okay, so what did you find when you were working in COVID that, you said something's wrong here?
Well, basically, the first few years, I discovered peculiar things and quickly learned that the California Department of Public Health is a state department that here in California that is more reflective about the political whims than actually public health. For example, we would receive throughout the years that I was there media inquiries about tattoos, for example, because during that time, the tattooing was becoming more and more popular. And I thought that some of the questions that the reporters would ask would provide some answers regarding whether tattooing is really, really healthy for you. My opinion, I don't think so, but that was my opinion, and I thought that the subject matter experts would weigh in on that side of my opinion, which is not really that's not germane. But anyway, so what the response was, well, this is not our issue. The Center for Environmental Health would toss the hot potato to the director's office. The director's office would toss the hot potato to the county health officer organization within CDPH, or they would toss that same question to the governmental affairs, and everybody was staying in their lane, but they weren't addressing the overall issue. Whether tattooing is good for your skin, for your human body. And I'll cite another example. CDPH would facilitate same-sex relations or needle exchange program, things that aren't really healthy, but from a political thing, that seems to be the popular thing. So having that particular experience between 2009 and the start of COVID in 2021, it kind of gave me pause to wonder, is the same thing going to happen here during COVID? And as my whistleblower experience that I will relate to you and your audience during this time that I have with you, yes, basically, it's more about what is political than what is healthy.
So people were basically avoiding responsibility for making hard decisions that actually talked about what was good and what was bad, even though this is for your health, right? So they wouldn't tell you the necessary truth on the health on controversial issues with respect to what's healthy or not.
Yeah, that is correct. And issues like a food recall, where there's a contaminant, where the food has been compromised, that is something that CDPH does really good at, alerting the public. But when it came to issues that, like I indicated, it would have been very unpopular. I laugh, and in retrospect, it would have been very unpopular to push, for example, the lifestyle that is, I'm trying to think of the word. It would have been very unpopular to push a monogamous lifestyle. You see what I'm saying?
Yes.
When a husband and a wife, a man and a woman are in a marital monogamous lifestyle, that's the most healthy.
Yes.
But that's not popular societally, and it's not popular politically.
Yes.
So when COVID came, and some of the stuff that I initially saw, I wasn't surprised because of the issues that I just described that happened between 2009 and 2020, but nevertheless, I was still aghast. And my first observation about what was going down was the face mask. Your audience can probably see behind me is a poster of my Muzzled Truth book, and that particular poster features prominently that blue face mask. I'm not a doctor, but I have common sense. And I'm thinking, putting something like that over my nose, over my mouth, wrapping that string around the back of my ears. I mean, I've had issues wearing glasses for most of my life. If my glasses are not adjusted properly, it can bend inside my ear and could cause a sore to appear. Okay, so I'm thinking I'm not going to put that string around my ear because it's going to really affect me, number one. And number two, it's going to cause it difficulty for me to breathe. But yet we were being told that we have to wear these face masks in order to protect us from one another. When in actuality, I make note of this in my Muzzled Truth book, where this one guy was talking on Fox News, and I cite this in my Muzzled Truth book. I forgot what page. He asked rhetorically, does a chain link fence stop a mosquito? And the answer is no. And he was making the point. That's how these face masks are not really that effective. So back to my observation, my initial observation about wearing these face masks. I remember going to my boss and say, hey, look, it's getting hot here in Sacramento. It can reach up to 105, 110 degrees. And I'm thinking that would a virus survive in that kind of hot temperature? I think not. Don't you think that we should issue some sort of news release encouraging or instructing people about wearing face masks when it gets 105, 110 degrees? That suggestion was dismissed outright. And so my thing is, Dale, I try to influence policy on that issue, and I didn't get very far with that idea, but I'm not going to subject myself. I got to look after myself. I'm not going to suffocate myself. And
Yes.
That's how I conducted myself on that particular issue.
Well, I can say that, from an engineering standpoint, we understand that these things don't work because the size of the virus, even in an aerosol particle, is going to pass right through that mask, right? So it doesn't work. It's not effective. Even the N95s that they got people to wear, not effective. What you would need was like a respirator and a fitted one at the best, or so forth, to do anything. And then if you moved and the seal broke, it was no good anyway, because you know what I mean, it was going in, and people that were sitting in their work all day, it wasn't going to work. They did everything that I saw that they did deviated from standard practice across the board.
Yeah, it's sort of enraging. I had all kind of feelings, Dale. I was enraged. I was upset, depressed, and a lot of the common sense of people just seemed to just left the planet. I remember seeing a couple of outrageous things. I can think of immediately three things. I ride a motorcycle, and I'm riding down Highway 99 going northbound, and I see a motorcycle coming the opposite direction. The guy had a helmet on, and he had one of those blue face masks on.
Oh my. That just, I mean,
I saw another guy wearing a face mask. This was a still photograph with no helmet. I saw this one person that was waiting for food to be delivered at a restaurant, because we had to pull in, order, and they came out with the food. There's a guy sitting to my left in his car all by himself. He had two face masks on. Now maybe, I don't know. I try to give people the benefit of the doubt. Maybe he had some sort of respiratory extenuating circumstance. I don't know, but it just seemed like common sense just left the planet during COVID.
yes, it did.
And I don't. And what bothers me in 2026 is that the people, the institutions, the politicians, the mainstream media, the public health professionals, the hospital people that foisted all of this upon us, they want us to forget and move on.
Yes, and this is
And
where
that can't
I
happen.
no, because like I said, I started out like in 2020. We were talking before. I have a background in mechanical engineering. I'm a technologist, got a bachelor's degree, and so I was doing called in to do some work on some dental clinics in Saskatchewan that deal with obviously the aerosol generating medical procedures they talked about. And so when I looked at the guidelines that we got, and the table that they used came from the CDC, but it was brought over to the Public Health Agency of Canada. They used it everywhere. And I looked at this, and I'm like, this can't work. Where's the rest of the information? And so I went and did some digging, and it wasn't there, because my first thought was like, look, my kid could die. Someone else's child or loved one could die, because I said, okay, say if it's COVID or should be something worse that people aren't going to get protected from. So I'm like, we have to do something about it. And I thought, okay, well, maybe this is an error. And then when I went to go and bring it forward, the amount of pushback I got, and people were trying to shift it, like you were saying, to this person, that person, but no one wanted to deal with it. And I was like, look, man, where's the engineering report? Where's the documentation that justifies this? Because if you don't have it, then there's a big problem. And they didn't have it. And so I get it. Like this can't happen, because if something, for example, God forbid, something worse happens, or like you saw with these biolabs that they're finding with like Nipah virus and all these different things that are Ebola that are extremely deadly, what's going to happen to the people if they go back with the same protocol? Right? You can't have that happen. It's just no.
Yeah. We have to, and I'm glad that you and other podcasters, because the mainstream media has moved on, and we need to hold them accountable. And every chance that I get, I'm sending information to mainstream media reporters who I knew, not personally, but by name, when I was a public information officer, because for those who succumbed to what happened, a lot of people died because of that. Because of them, we can't let this. They cannot be forgotten.
Absolutely.
So,
I agree.
So yeah. So anybody who has a platform like you, thank you very much. And I encourage people to write a book about their experiences, because the more books that are written, that helps keep this issue alive.
Yes, and like I say, people will share this out, because these are things that if they're not rectified, they're going to happen again, or it will get worse. COVID was like this. This was crimes against humanity, and this was done by, I mean, the structural problems that they have in all of the government agencies cannot be left again, because we left the way that they are. We saw exactly what happened. Yes, there were some people who did wrong, but there was a lot of people who just couldn't do anything because it was designed for it not to go forward. Like, I mean, you saw all of the problems. There's no communication between the agencies. Everybody, the right hand doesn't know what the left hand is doing, and then people are getting pressured not to do what they want to do. And you saw how many whistleblowers are like, well, I ended up leaving my place because they either got forced out, they lost their jobs. Like, look at all the doctors that were like, this was wrong. They got lost jobs, got stripped of licenses, and so forth. You can't have this happening. There's no way. This has to get dealt with.
Well, I had an incident that there are two main pillars of Muzzled Truth. Number one, the California Department of Public Health rejected a very good treatment, which is ivermectin, and I brought this issue to my management in October of 2021. And then the second pillar of Muzzled Truth has to do with the COVID-19 vaccine is killing people. But back to your point regarding the siloing of government departments, when I first informed my management in October of 2021 about properly dosed ivermectin, their response was, look, we don't approve of treatment. That's the job of the FDA. In essence, Dale, they wanted, and they successfully hunted the issue to a federal agency, 2,000 or 3,000 miles across the continent. And I'm thinking, here we have this important, alarming, emergency public health threat in California. Rather than hiding behind regulations or whatever, we should be thinking out of the box and treating people with a treatment where, I cite Dr. Pierre Corey. A year earlier, he had testified before Wisconsin Senator Ron Johnson's committee, and he said, look, I treated and cured more than 8,000 people with properly dosed ivermectin. I mean, don't you think that's great news? And that was the tonality of my email in October of 2021.
Yeah, I agree. And for myself, my side is prevention of disease, right?
Mm-hmm.
Because if you can prevent it, then that's better. Obviously, if you can treat it, if you get it, then treat it. And so the way I looked at it, like when you look at pretty much any literature when it comes to engineering controls in an airborne pathogen, 80% of your at least 80% of your infection controls comes from engineering controls. So you can reduce transmission by up to 80%, even in some cases higher, by using proper engineering controls. Like, for example, like you say, you're in Sacramento. It's very hot inside there. So a lot of places are going to have air conditioning in the summertime. This is where you're going to end up having more transmission inside of indoor spaces. This is what people understood, because what do you have to do? You have to recirculate the air, because the cost of bringing in fresh air to cool it is insanely expensive. So what do? they recirculate the outdoor air with they mix the outdoor air with the recirculated air and so forth. So if you put things like, you had your proper filtration, which isn't very much, but putting things like UV in the ductwork, you could like destroy the pathogens. You can increase the life of your system and your efficiency by getting rid of the biofouling and so forth. So your fans and your cooling coils are going to work better. They're going to last longer and save money. And I propose this to people. So you're going to save money. You're going to avoid a lot of the lockdowns. And I'm like, this is a win-win situation. But then it was like the hammer came down because it's like somebody didn't want that coming because that meant accountability. Because in my line of work, if somebody dies, somebody's going to jail. Like if a bridge collapses and people die, they look at who did the engineering, and then the next thing you know, you're going to court. This is not like, oh, you get a slap on the wrist because you can't give people back their lives, right?
Yeah, wow. Yeah, it seemed like a lot of common sense things that could have helped people, it was just ignored. Because while you were talking and you were expressing your experience, I was thinking about when I shared the information with my management, what I shared, they kept saying, oh, this is your personal belief. And I kept saying, no, this is the information I've learned. This is what I'm sharing with you. Now, my personal belief that I did not express then, but I'm free to express it now, and especially at hearing what you're saying, is that the agenda had nothing to do with public health. This was all a setup to impose global totalitarianism. Because otherwise, common sense response to what you suggested, or what I suggested, what other whistleblowers or other people suggested would have been welcome. But what happened? It was the opposite effect with you, opposite effect with me, and a host of others. A lot of subject matter experts, doctors, they were censored, deplatformed, the licenses were removed. So yeah, this had nothing to do with treating or curing people. It has everything to do with imposing control over people. And they used this public health incident to do just that.
Absolutely. This was all about, control, people making money, and so forth. Right? Like, I'll just pull this up here while we're talking. This is a book that I wrote called COVID-19 and Negligent Engineering Practices. Will This Kill People? Because these were a collection of studies that I did during the course of my degree that was overseen by professional engineers, by PhDs. And I talked about the infection controls and everything else like this, showed what was wrong, proposed solutions, multiple solutions, and picked the best one, and showed how people should have actually done this. And if people had used this work, people could have went to their government and said, look, man, this is what the science actually says, and I'm not shutting my business down because I followed this. And they would have to bring someone like me to court and prove to them why what the government was doing was right, because I have the established engineering. This is just common sense, good engineering practice. What I was following, what they were, was not. And they didn't want this to happen because how many people lost the shirts off their backs? How many families got destroyed? And then for what purpose? This is preventable. This is the biggest issue, is that a lot of this was preventable, and there were a lot of people that made a lot of money off of this. And so that's,
I think, another the destruction of small businesses. A lot of people became poorer and poorer. A couple of weeks ago, I was walking downtown Sacramento, K Street Mall, and during that particular walking, I looked at all of the small businesses that I used to go to lunch by myself or meet people for lunch with friends or coworkers. They're all shuttered. They're all shut down. This place where I used to get great chocolate chip cookies Another place where I used to meet a former boss, we would eat at this Hungarian restaurant. Another business place where I had lunch with a coworker and our former boss. All of these places are shut down, and they were steering people toward the corporately owned businesses, and they were basically eliminating, canceling the small mom and pop businesses. So I always have a heart for small mom and pop businesses. I have a cookie jar not too far from here, and I love chocolate chip cookies. And so I was on my way back from someplace, and I zoomed past this bakery. I was on my motorcycle, and I went about a mile down the road and decided to make a U-turn, come back, and get some chocolate chip cookies from this small mom and pop bakery. I have a heart for these businesses that, particularly, they survived COVID. A lot of them did that, did not. Most of them did not. Matter of fact, I have a relative who has a photography business. He and I were talking just yesterday, and how his business was just beginning to pick up. COVID hit, and he's treading water. He's just about ready to get on the boat right during COVID. I'm using that as a metaphor.
Yes.
But he's back in the water, trading water, going under, coming back up, going under, coming back up. And he said, I don't think I'll ever be able to get to the point where I was before COVID.
Yes, a lot of people didn't recover. We're going to take a short break, and we're going to come back and talk about this a little further, because I think this needs a little bit more attention. Thank you.
Hello friends, my name is Keisha, and I'm a proud member of the Métis Nation of Saskatchewan. And I'm also a survivor of human trafficking. My trafficking began in Saskatchewan, moved into Alberta, and even crossed into the United States. I was stalked, hunted, and ignored by the very systems over the last 5 years that were meant to protect me. This is why, with my father Dale Richardson, we started the CARES Project. This is an Indigenous, survivor-led movement for humanity dedicated to exposing trafficking, government corruption, and holding institutions accountable. One of the most powerful tools that we are using is the petitions for redress of grievances. These are lawful constitutional actions rooted in Canadian and US law, and in treaties that tie us together across provinces, across states, and even across borders. These petitions are precedent-setting. They create a binding record. They demand accountability while representing reconciliation in action. Indigenous and non-Indigenous people working side by side to preserve liberty for all. But we cannot do this alone. We need your help to keep this movement alive, to raise awareness and to build a legacy of justice for Indigenous women, for trafficking survivors, and for families everywhere. Thank you. Please stand with us. Your support makes this work possible. Together we can restore justice, heal families, and defend freedom. And I will close with my favorite quote. The greatest want of the world is the want of men. Men who cannot be bought or sold. Men who in their inmost souls are true and honest. Men who do not fear to call sin by its right name. Men whose conscience is as true to duty as the needle to the pole. And men who will stand for the right, though the heavens may fall. Thank you.
Yeah, so if anybody wants to support the work that we're doing here at the CARES Project, you saw the QR codes that you saw on the video that we played, or you could go to dsrcaresconsulting.com/the CARES Project Action Plan, or you can support by using mypillow.com/CARES, or call 800-845-2942. Use the promo code CARES. They got a lot of good stuff. We also, if you're watching on Rumble, Facebook, or on Vocal, you'll see the links in the description. We have a lot of different products and so forth, or if you want to support directly, you can see the donor box where the gifts send go. If you like the content and support the work to get justice for the people and the fight against the human trafficking. All right, kind of getting back to what we were talking about with the small businesses. The destruction of the small businesses is critical because I know here in Canada, prior to COVID, like I think it was like 68% of people were employed by small businesses.
Mm-hmm.
That is the lion's share of the population.
Mm-hmm.
And in the United States, it was something comparable to that. So you're looking at the middle class America being wiped out, the small business owner being wiped out, who is more accountable to the people. Because if you know, John and Bill and Patricia, that they're depending on this job to feed their families, and you have that sort of accountability, you know them, you have a relationship with them, they work for you for 20 years, you're not going to want to let them go rather than some guy sitting in some office tower in some city that you've never seen, could be even halfway across the globe, that's like, oh, well, where profits are down, so X that whole division over there, give them their walking papers, right? It's not the same.
No, it's not. It's again, some of these people, as I indicated, the small business owners, I built up a relationship with. Matter of fact, one that did survive, she has a cookie place. I guess your viewers are beginning to see a pattern here. This particular cookie business has been in existence before I even started in state service. So I started in state service in when? 1990, 1994. And so I remember going to this particular cookie business when I was a student at California State University, Sacramento. So yeah, I built up relationships with a lot of these people throughout the years. And I don't know what happened to them, those that went out of business. And it's sad,
Yeah, because you have things that were like pillars of the community. They gave back to the community. They were integrated into the community. And then you saw this being destroyed. And when you look at it, like, I have to look at things objectively. And people talk about, conspiracy. This is not conspiracy when you're looking at what is happening in front of you. And you're looking at the destruction of the businesses. You're looking at who's profiting from it. You're watching the government policies that just seem to just, like, become insane because they're like, well, this was the accepted practice today. Tomorrow it's no longer this way. And then you see what happened with the shots, and you look at all the research, because I've looked at a lot of research with a lot of the doctors, like, earlier on, and I'm like, I can't believe that this is happening. Actually, General Michael Flynn, when he was in Afghanistan, he was looking at something called stovepiping, where the restriction of information with a lot of the different agencies that were there. And when he was part of the Defense Intelligence Agency as the director, he wanted to get rid of that because he's like, we need to have more communication because it's going to, you're going to have better effective work. And if he actually was successful, they wouldn't have been able to do what they did with COVID because all of those government agencies would have started to communicate, and a lot of these things that were slipping by would not have happened. And the hammer came down on him, right?
Mm-hmm.
And so I look at, and this is what you got. They went after him during the, Obama got rid of him, didn't like him, and told Trump, don't trust him. But this is why a lot of people don't like him, because the status quo he would have changed. A lot of people would have not profited. It comes down to a lot of money.
Yeah. I came across some information that the second pillar of my Muzzled Truth book has to do with something that I learned coming up on 4 years in April. I was on another social media platform. I think it was Telegram. Yeah, Telegram. And I came across some information about what Department of Health and Human Services Secretary Javier Becerra, he was featured, or he was appearing on a virtual Convening on Equity White House summit. and he was talking about the COVID-19 vaccines, and he said, quote, "We know the vaccines are killing people of color, blacks, Latinos, indigenous people at about 2 times the rate of white Americans." He acknowledged that these vaccines are killing people. So I did some research, found some data. The data that I found didn't indicate that people of color were dying from the COVID-19 vaccine 2 times the rate of white Americans. The data that I found discovered that people were dying from the COVID-19 vaccine. Matter of fact, at the time that I sent an email to my boss in April of 2022, there were more than 26,000 people across the United States, according to the Vaccine Adverse Event Reporting System, who died from the COVID-19 vaccine. Now I have to contextualize this. Years earlier, in 2003, and I discovered this during my research, there was a vaccine program involving healthcare workers, smallpox vaccine. Did you know they stopped that vaccination program after 2 people died? And
Yes.
here in 2022, we have more than 28. No, I better look up my notes. Exactly 26,976 deaths. I also indicated to my bosses then that there were people that were injured by allergic reactions, facial paralysis, miscarriages, heart attacks, heart inflammations, seizures, strokes, and sudden deaths. So the response I got from my boss was, "Thanks for your email, Ron."
Wow. When I looked at some of the research of from this mRNA technology, it was never good. It never worked. And I don't know why. There's no good reason to give somebody out like this. Like, there's just all the steps that they did. Normally, when you have testing for anything, you have to go through rigorous testing. And when it comes to human beings, it has to go through an additional level of rigorous testing, no matter what type of field you're in. Whenever there's a risk of harm to human beings, it has to reach a certain threshold. This went out the window everywhere. And this is where I have a problem. And the institutions that were supposed to be there to protect the people, they did not. And again, like you just said, you were like showing them all this stuff about the vaccines, and they're like, well, that's nice.
Let's move on.
Yes.
Let's go out to lunch. So yeah, so between April of 2022 and October of 2022, I was tracking the injury count, the death count from VAERS. As a matter of fact, what is shown on VAERS is a very, very small percentage of the actual number. So we can add a couple of zeros to the more than 26,970. Well, actually, exactly 26,976. So add a couple of zeros to that. That's probably the real picture of how many people died from the COVID-19 vaccines in April of 2022. So in October of 2022, I revisited the issue. I noted that there were more than 31,000 people who died from the COVID-19 vaccine across the United States. I even noted that in California, there are more than 600 people who died from the COVID-19 vaccine. Again, I'm going to contextualize what I just said.
Yes.
Earlier this month, the California Department of Public Health issued a news release saying that there were, either 6 or 8, Dale. I don't remember the precise number. Let's just say 8 cases of people who contracted measles in California. That's under 10 cases. Here we have, for the record, up to this point, now it's more than 700, almost 800 Californians who have died. Not cases, but actual deaths. So I'm thinking, okay, say for example, there's this banquet and there was a food poisoning at this banquet, and 760 people died from this food poisoning at this banquet. Don't you think that would be big news?
Yes, it would be.
But it's not here.
This is because it's politically incorrect or inconvenient to talk about these things. Like, California is actually a lot like Canada. Wherever something happens here, you see it go. One of the first places in the United States it goes to is California. And I know that Gavin Newsom and Trudeau were good buddies, and they seem to be towing each other's line. And the brakes need to be put on this, because the government is designed to protect your rights, not deprive you of it, regardless of what the cause is from, because there's a number of causes for each person doing things. But at the end of the day, is that wrongs were done, and it needs to be righted. There's a lot of people who are vaccine injured that need to get help. And when you look at from how this thing began, you look at what they were talking about with the COVID Select Committee, with what Peter Daszak and the EcoHealth Alliance was doing over there, and then what they sent over from Canada to go and that was publicly that they put all this information out, and they were doing unlawful gain of function experiments out in Wuhan. And then from that getting released, they're like, here, now take this thing that is experimental. Are you joking? No. Like, I mean, you just see one step after the other. And then when people come to report, like there's a girl here in Canada, she was perfectly normal, got her vaccine, got her shots. Now she's in a wheelchair. And now they're saying, well, you know what? Here, we can give you government-assisted suicide instead of dealing with the problem.
Wow.
Yes.
Wow.
And that's what's happening here in Canada. Like, this year, 100,000 Canadians have been killed by this medically assisted suicide.
Wow.
And now they don't have an organ donor problem, and now they want to push it to people who have mental health issues and do it with just verbal consent. And you might have to wait like years for surgery. People are dying not getting surgeries, but you can walk in and say, well, I want to die, and they'll kill you that day.
Wow.
Yes. And it's in 14 states now.
Wow. Oh, boy. Well, I was told by my management that, again, this is all my personal beliefs. The information that I shared with them was my personal belief. The data about the injuries and the deaths were my personal belief. And in October of 2022, rather than dealing with the information that I provided, they threatened me. They said, look, you're wasting, we're concerned that you're using state resources and state time to do your research. Again, not alarmed about the people that are injured, not alarmed about the people that died. They're focusing on the messenger. And I had...
Well, just hold on a second. You work for the public health, right?
Yes.
But wouldn't trying to protect the public health be part of the working at public health?
Again, this is not the California Department of Public Health, and I should have made this observation when I was talking about the political climate. This has to do with the California Department of Political Health.
Which is what it seems to be like, honestly.
Yeah. All has to do with what the governor wants, what the administration wants, what what Big Pharma wants, because you're talking about people that were impoverished because of what happened. Big Pharma, they made a lot of money during COVID. That's why there was a concerted effort to go against the using of properly dosed ivermectin, because that's a relatively cheap way of treating somebody. So I think at our level and above, it was a money making operation. But above that, whoever was behind all this, and I have my suspicions, and I'm sure you and your audience do as well, there was a depopulation component at play here. There's just too many of us, and you're just not dying quick enough, Dale.
It's actually very apparent. And I actually talked about this in some of the reports that I put together, and I took work from Dr. Macus, who did a lot of the work on the excess deaths, and from Dr. Paul Alexander, who's the epidemiologist, and I did a lot of other doctors, and then look at industrial hygienists, and then work like with Dr. Peter McCullough and so forth. I began to look at everything that everyone was doing, and I looked at what they were doing with the engineering controls, and then how they were doing this gain of function. And I said, this is exactly what you would expect to find if somebody was trying to destroy people using biological agents. And that's what this is what it looks like, because everything they did would have helped to facilitate the spread and maximize the destruction, rather than allowing people to get the help that they need. And then when you look at the way they're treating the vaccine injured, they're not getting help. They're just leaving them to suffer. And then in Canada now they're saying, well, we'll just kill you. I'm a Christian. This is satanic.
Yeah.
There's no other way to put it.
Well, that's what fuels me, is the vaccine injured. I prematurely retired, immediately incurred a 55% pay cut, which was the difference between my salary and my pension. And so what fuels me is, like you just noted, the vaccine injured. God put me in this position to be their voice. So when I go from county to county, there's 58 counties here in California, and each county has a board of supervisor. It's like a local legislature. And so the California Department of Public Health has a relationship with the county health officer, with the county public information officer. So the reason why I'm going from county to county, I'm doing what the California Department of Public Health should have done way back in April of 2022, and still could now do, by sending out on an email blast saying that these vaccines are not safe and are not effective. And if you don't want to say that, at least you can make it a very tepid communicate by saying that these vaccines aren't safe and effective for everyone. At least do that. So when I stand before a board of supervisors, I provided written notification in July 2024, another written notification in December of 2024. I'm following up that July 2024 written notification by going from county to county. I don't talk about the money-making aspect of what happened or the depopulation agenda. I am very disciplined in my communication, because that's not what I experienced at the California Department of Public Health. I only shared what my experience is. Now, other people can make those public comments, but in what I'm doing, I have to be disciplined in my communication to the board of supervisors.
Yes. And for me, when I go and I present something, I present it in a specific manner. But with what I do, analyzing risk is inherent in engineering. You have to say what could happen, what's the chances of it happening, what's the consequence if this happens. And no matter how small the consequence, if it results in somebody losing their life, you have to mitigate that risk. This is the way we're designed to think, because you can't give Johnny his life back if he dies. You can't, right? It's not like you lost some money, you can get it back, where insurance will pay for that. Well, you can't give somebody their life back. And so this is where we're seeing that failure. But I mean, I told them, I said, this is what's going to happen if you don't do anything, and so said, so done. Right? Like, this was not unforeseeable. And this is where we have to continue to do these kinds of things. And I'm glad what you're doing to go out and let these people know, but we need to take it a step further. We need to take it directly to the government so that they know and give them notice of that. Because the legislative body is the one that's responsible.
Well, I think God is leading me toward that direction. I'm talking about the state capitol. I've gone to 52 out of 58 board of supervisors. I met Julie Threet. She's a Butte County whistleblower in her own right. Basically, she was a volunteer at her local hospital, and she wanted to help the community. And basically, she saw some things that weren't right. Matter of fact, she tells a story about a very in shape athlete. As soon as needle was inserted in arm, he collapsed. And she saw other people that were somebody trying to call me, and I just had to hang up. It was a spam call. So yeah, basically, I met her in October of 2024 when I went to her board of supervisors in Butte County, and she and I have partnered going from county to county. She's gone to 33 or 34, spoken many, many times before her home county, and I've gone to 52. So after we complete our county, I get a sense that God is going to direct us toward taking this issue before the California State Legislature. We've already had conversations with gubernatorial candidates here in California, and because they're trying to normalize. And I'm just learning about this mRNA technology, and I appreciate and respect your engineering analysis. I'm just kind of getting up to speed with that aspect. I'm a simple man, okay? When somebody in power says, we know these vaccines are killing people, I don't care what's in it. People need to know. You know what I'm saying?
Yes.
And it's going to lift up people like you, subject matter experts who can really describe why these vaccines are dangerous, what it's doing to the human body, how come it wasn't tested before it was introduced to us all. So yeah, I appreciate your engineering background.
Yes, and we needed people in all different areas to cover all the different areas, like you having the understanding of the public health and people who deal with that. But if you want to go to the state house, I can help you with that, because one of the things that people have not been using and they've been underutilized is the petition for redress of grievances. And this is the type of thing that people need to do, and I've been helping people doing. We've done them here in Canada, submitted to the federal government. We're working with people in the States to do this so that people can get back their rights, because that belongs to the people. Talked to Sheriff Richard Mack, and he said that this is the way to go, and then take them to your local sheriff, so if they don't do something about it, then they can be investigated, because these are crimes, and you're going to have to work with everybody who wants to protect the people to get this dealt with, because the government needs to be held accountable. Petition redress is the strongest thing anybody can do. Go ahead.
Yeah, I know we got to wrap it up. I guess we got 2 minutes left. This has been a fast hour.
Yes.
One of the main reason that Julie Threet and I are doing what we're doing is to influence local officials to do the right thing. And for the most part, they're not. There's a small percentage are, but for the most part, they're not. But having gone to 52 counties, I am addressing we the people who are sitting inside the board chambers, we the people who are county staff who are watching the proceedings from their desktop computers, we the people who are watching on the replay or watching remotely. We don't know how many lives we've touched by bringing this information to local elected officials who for the most part aren't doing the right thing, but we are informing we the people along the way.
Yes, and that's very good. We'll keep in touch after this because this is something that needs to be brought forward because, like I said to people, the power rests in the hands of the people. And the people are the ones that have to solve this. And who has a better vested interest in looking out for your rights than you? Right? Nobody's going to do it for you. So this is the right action reaching the people. Yeah, how can people reach you and how can they help you? Because I'm going to close here with a prayer here before we go. So let people know how they can reach out to you.
Well, my website is muzzledtruth.com, muzzledtruth.com. And there are a lot of stuff on my website where people can read about my whistleblower story. My moniker on X is Muzzled Truth 1, numeral 1. And I'm on Facebook. I've been shadow banned on Facebook. I think I'm being shadow banned on X too, but it is what it is. On Facebook, it's Ronald F. Owens Jr. That's my Facebook page. As soon as I started posting a lot of anti-vaccine stuff, or I get shadow banned. I also have another website, ronaldfowensjr.com. I've written 5 Bible-based books, and I've rewritten about 10% of the Bible in newspaper format. That's called the Testament Spectator. And so people can support me, buy my books, Bible-based books, or go to muzzledtruth.com to buy Muzzled Truth in paperback, ebook, as well as audiobook. So that's how people can reach me. And there's a contact information on my muzzledtruth.com website for those who want to send an email, or just send it to ronald@muzzledtruth.com.
I guess I like talking myself. I forgot to unmute. Yeah, so if you're in California, reach out, give him some support, and follow him and so forth, because we need the people to kind of come together and start dealing with this.
Mm-hmm.
And like even now, one thing that we have to realize now that Epstein, with the Epstein files, you saw that Epstein had his hands in COVID, and now you're seeing the link. And when
you know what? Thank you. Is this? I'm not straying too far from the fact that COVID was mentioned in the Epstein files. It was part of the plan. It was a plan. Am I correct?
Yes. Epstein was working with all of these guys. And you know what happened as a result of COVID? Trafficking went through the roof as a result of this. And this is where I have a huge problem. Because I talked to DHS whistleblowers like Tara Rodas and Aaron Stevenson and other J.J. Carroll and so forth, and they said the rates of trafficking just skyrocketed through COVID. And then domestically with the child protection services and so forth and the family courts breaking down, these are getting exploited like crazy. This is one of the worst costs that you see of this, because when people are broke, they have no jobs, they're going to drugs and all these kinds of things. This is how you exploit the children, right?
Again, I think this was intentional.
Yes. And so this is why we need to deal with this stuff, and all the people need to come together, because at the end of the day, you have to protect your families, your loved ones, and your children, right? Because, and this is really what it's about. And so as Christians, we have to stand up for this. This is not a political issue. This is a moral issue. You cannot let people do this satanic filth and just stand by and do nothing. God doesn't sanction this. So I'm going to close with a prayer, because we need a lot of this in this country now. Heavenly Father, Lord, we thank you for this day. We thank you for your love, your grace, your mercy. Lord, we thank you for the work that Ronald is doing to bring this light of truth to the people, and all the people that are working to do the same in all these different areas. And help us that we would come together, and the men and the women would come together to rebuild our families, our churches, our community, and our nation, that we can have some protection for our children and to deal with this evil wickedness is my prayer. In Jesus' name, amen.
Amen. Well, thank you for allowing me on your program. Thank you, sir.
Yes, and thank you for coming in.